Welcome back from that commercial break. This is Family Hour, empowering families one episode at a time. And of course, today we are talking about ultrasound scans. And before the break, we really looked at we looked at the different scans. They told us about the CT, about the MRI, and all those. Now, our emphasis is on ultrasound and why it is really very important, especially in what we call modern medicine. Because you realize there is a thing that people always refer to. Our great-grandparents never had scans. Did they survive? How were they able to give birth to children that didn't have issues? For example, the parents. So someone says, I mean, we have very many people who still stick to that, and they refer to that. So before we even continue, what is your say about that? Because there are very many people who are stubborn. They say, me, I will not go.
Well, if you're there watching us on Family TV and you still have such a belief, it is high time you change. One, previously, we really didn't have those statistics. Those statistics are not there. Now, we are in a world of statistics. How sure are you people we are not dying? The statistics are not there. And another thing, you're talking about a generation where our mothers, our grandmothers used to be used to be pregnant and not sit down and relax. Unlike in this generation, where once someone gets pregnant, plan the wife, sleep. So, honestly, I would say, you can't compare that time to this time. Because before we went for a short break, one of the advantages of ultrasound that I gave were that we want to know how the baby is placed in the uterus. Or I can say, in a layman's language, in the abdomen. So, if the baby is presenting well and good for ultrasound. But one of the factors that help the baby to present well is being active. So you're comparing yourself to mothers who are active to your inactive, like to mothers who are full of inactivity when they get pregnant. So you don't do an ultrasound, you've been sleeping, the baby is not presenting well, you go and just push problems. And another thing, have you also noticed or looked for the cases of cesarean section or kuchiso, bagenda kuchiso kuzala nechiso? Are the cases of cesarean section increasing or decreasing?
Increasing.
And if they are increasing, why? Because now mothers can know when it's time and prepare for that. Cases of uterine ruptures, are they increasing or decreasing?
Decreasing. Because
they can now know that once I try to push this baby, things are not going to be good. Yeah, that is what I can say.
Now, there is also this I don't know whether it is truth or a myth, but mothers out there, now that we are talking about pregnant mothers, don't want to believe the results you give them. Why? For example, I think it's called the expected day of delivery. That you give them days that are false. For example, you tell them probably you'll give birth in let's say June or July, and then they give birth in late May, or they give birth in early June, yet you told them the scan results told them July, or maybe the scan results told them you'll give birth in July, and then they give birth in August. So some mothers have developed a disbelief in the results the machines give them. What causes this variation?
That variation is supposed to be there. That is news I have for you. Why is it supposed to be there? Only that it is not as big as you've been. Okay, you were just
I've exaggerated it. I was giving an example.
Okay, but you exaggerated it. So, but once we are giving results, we give a provision of 10 days after or before that date of delivery. So, why do we give that provision? So, I may say that 29th June, and then maybe you produce on 5th July. Those variations are supposed to be there. Because how do we estimate that date of delivery? We measure on the anatomy of the baby. So, or the fetus. So once we are measuring on the anatomy of the fetus, we are trying to see, okay, if this baby has a foot or a femur bone, for example, of 6.8 centimeters, the machine is programmed that now a baby with these centimeters is going to be having, for example, an average gestation age of this, or 30, maybe, for example, in that case, 32 weeks. So you're looking at a case where you're comparing yourself with a mother who was very okay, very healthy for the entire time when she was pregnant. So for you got maybe some kind of sickness or problems, dates, you are kind of stressed. That stress does not make the baby like grow healthy, like the fetus to grow the way it is supposed. So you get some growth retardation. So once you get some growth retardation, I'm going to measure, and maybe the scan will give me a date that is a little bit higher because it is showing the baby is young. Like you get, the fetus is not as at that age. You get. Yet, in the actual sense, the body, its physiology knows that now this baby has stayed for 32 weeks. But then there is that retardation that will give me 31 weeks. You get. So one, you have to know that we measure on the anatomy of the baby. Two, we call it average, or we call it average gestation age. An average, or we give it as estimated date of delivery. Why do we say that it is estimated? Your sister may give birth at 38 weeks, and then my wife will give birth at 40 weeks. So, but the machine is set in a way that it will tell you that a person has to produce at 40 weeks. So your sister will produce at 38 weeks and consider my results not true. But my wife, who has gone to an imaging center, and the machine is saying at this day you will be 40 weeks, and then you produce at 40 weeks. You get.
Yeah.
However, an advice I can give, mothers who really want appropriate scans, it is very important for you to make a scan in the first 3 months of pregnancy. Once you know that you're pregnant, in the first 3 months. Why? Because the variations of Atena Alwade, Atena Suzenjala, those ones are really not there at that point. So it is almost close to accurate. Yes.
Okay. So unlike the reality where mothers will say, me I'll get 7 months, or I'll go at 8 months just to know the sex so that they can maybe purchase.
True.
I'd do the shopping for the child. But one time I was in a hospital. So when I was sent to the laboratory was just opposite the imaging facility. And then there was this woman who was told to take a lot of water. I saw her with, I think, 2 bottles of 1.5, and she was taking this water, and occasionally someone would come and tell her, you take more and more, take more. And so when someone comes, and me, I was scared. I was like, so when you're going for scan, you have to take a lot of water, even when you don't want to. I was scared. It was, it was an early morning, a little cold, and someone is telling you to take water, take water. Sometimes it becomes uncomfortable. And so when someone comes for scan, for scanning, what should they expect? What are some of the things they should do? Should I first have my heavy breakfast? Nsibe ntanda, what is good? Nsibe nkokoto, all, I mean, things like that. What should they expect? And what are some of the things that they need to know as they prepare for ultrasound scan?
Basically, if we talk of ultrasound, it was designed we expect that a person who comes for ultrasound is sent by a well-trained medical personnel, a doctor, a nurse. So we expect that they should be explaining to them. However, if they are not now, for like viewers who have gotten that chance of being told, like now, let this chance not slide. So we have different scans. If you're going to do a scan and you're pregnant, you do not need to take water, especially if the pregnancy is maybe greater than 8 weeks, that is 2 months. You do not need to take water. But why do we ask for water? We want to ask for water because as I explained, sound is reflected back. So once sound is reflected back, it gives us an image of what is going on. So for pelvic scans, if you want to do what you want to know for men, because we have over talked about women. For men, if you want to know your prostate, like you want to know what is disturbing your urinary bladder, anything in the pelvis, you need to take water. If you are a non-pregnant woman and you want to know PIDs, like ladies, nowadays there is a way they have a lot of infection. So you need to take water. Water is going to help a radiographer or the person working on you to clearly differentiate the organs that are inside your pelvis. It will act as a window to give you an accurate diagnosis as compared to someone who has not taken water. Because if you do not take water and maybe the radiographer or they want to work on you and you refuse to take water, for example, chances are high you may not get an accurate diagnosis. So you want an accurate diagnosis, take the water that the doctor has advised you to, and then everything will be well.
So what is the importance of this water? In the process.
The process is that you take water. The most important thing is not the water. The most important thing is the urine. Have your bladder full.
Okay.
The water will be taken in by your kidneys and so on, and then we want the urine. So if you have taken porridge from home and you explain that now I have the urine, even if you have taken juice, you explain I have the urine. That is what we want. We want a full bladder. A full bladder is going to give us a window to differentiate. This man's prostate is enlarged. This man's prostate is having nodules So if it is chances are high this person is going to get cancer. But with an empty bladder, I will not see the margins clearly of a prostate. I will not see the margins clearly of the uterus, the ovaries, in cases of a non-pregnant woman. That is the deal with water.
Okay.
And for pregnant women, why we don't ask for water? Because the baby is growing in amniotic fluid. That is also fluid. So we already have a window with that water that is in the uterus. Because you know the baby akulira mu mazzi.
Okay.
Yeah, there is that amniotic fluid. That is where the baby is, and it will give us the window. Unlike in a non-pregnant woman, I think I'm making sense with that.
Yes. Now we know why you should take water, and it's not a must that everyone is supposed to take water. It depends on the fullness of your blood.
Exactly.
So the other thing, you know, this I'm representing thoughts of people out there. Some other people say the girl you use to them is uncomfortable to them. Why do you have to use that? Is it a must that without that girl you can't get the results?
Definitely, you can't get results without girl.
What is the magic?
One, I'm going to tell you the magic, but I will begin by telling you that girl is absolutely harmless. It doesn't have any effect. Like, there are no cases where you will see that bantekako gero nenjeruka
nanjo
kyolubuto. Those cases are not there. It is just girl like you see normal girl. So its components are really harmless to everyone. Then back to your question. Why we use girl is, you've noticed we don't do ultrasound of the lungs. Air will interfere with our results, or with the sound. Sound does not travel well in air. You get, but it travels well in water. That is why we are going to need urine, a full bladder, because now we are going to get that. You get, we are going to get that window. Back to the issue of air. Because now we have this like normal hair that is on our body. It traps in air. Once it traps in air, we want to eliminate that air by putting that, because girl is fluid like, so it eliminates away that air and the sound will travel well. If there is no girl, there is no ultrasound, because the air will not allow us to see. And once you push it, it will interfere with the results and you will not get clear results.
Okay. Yes. Now we know. So whether you say that it is uncomfortable or comfortable, you have nothing to do. You have no option but to go for it.
True.
But anyway, as long as it is harmless. Now we have people who have who are anxious when it gets to going for ultrasound, that they'll even take a day. For example, the doctor tells you, go and do an ultrasound scan. They'll first go back home, think through it, and make a lot of consultations, pray to God and recite all those prayers because of anxiety, because of the fears. And some people think that the moment they send you for an ultrasound scan, then it is a very complex issue. The next thing is an operation. So I think that is where the anxiety comes from. We have believed that each time you're told to do an ultrasound scan, it is a severe or a complex case. And so the next thing might not be a good one. What do you have to say about such people who live in anxiety, who live in that fear, who, as we speak, there might be even someone we are speaking to, 3 days down the road, they have the result. Each time they wake up, they look at this recommendation by the doctor and they're like, oh God, nazza gwachinze.
Okay. So I want to begin by giving good news to viewers of Family TV. People who have been on this show, by the end of this show, that will not happen to them again, because by the time we are talking, at this point, everyone knows ultrasound is very harmless, and the anxiety is not going to be there anymore, because one, ultrasound is harmless. Two, it is 100% helping you, the patient. Once the doctor has requested for an ultrasound, they actually taking an extra step to do correct things on you, like they want to be accurate in treating you. Otherwise, we don't want, ultrasound is like a torch. We don't want to treat people blindly. So you want to treat someone blindly. If they don't do ultrasound, you're going to treat people blindly. So you want to know, okay, what is the difference between a patient who just goes to the pharmacy or clinic and asks for Panadol and they feel some bit of relief? Otherwise, a doctor can choose to do that. But why they ask for ultrasound, which is 100% harmless, is they want to give you a correct, an accurate diagnosis, like you get an accurate diagnosis, accurate treatment, and the disease or anything you have will be gone for good. Unlike when you keep on treating symptoms. Your problem is you have like maybe the spleen or the liver has some problems, and then your eyes are turning yellow. Instead of treating the liver, you're going to the pharmacy and you're like, Masawo, maso gange gamyusemu bampa ka eye drop. Okay, it may clear or it may not clear, but once it clears, this is a sign that you're treating, but you're not treating the problem. So you want, ultrasound will help you to get rid of your problems once and forever.
As we wind up, Bruce, give us your closing remarks. A message that you want someone to keep at the back of their mind as they reflect on what we've talked about.
Dear Family TV viewers, we really thank you for tuning in. We really thank you for always following us, and I'm glad that you are on this show, and I think most of you have really learned a lot, and thanks be to God you have, I believe. So I want to concentrate more on ultrasound. We began by talking about other imaging modalities where you've seen your patient, your relatives, yourselves going there, for example, x-rays, CT, things like that. But for today, for the cases of ultrasound, every viewer, every Family TV viewer who has gotten a chance to watch this show should not have any anxiety or any fear about ultrasound. It is 100% helping you and your doctor. If you keep on prolonging or fearing or having that anxiety on a totally harmless but rather helpful to you, you're really going to have problems with your health, and you are going to give your doctor hard time. That means you will always leave one doctor to the other. Ono doctor tachankolera, ono doctor byakola tabimanyi, but they have been sending you for ultrasound results and you're not providing them. You're leaving them with no option but rather treating your symptoms, you get relief, and then it comes back. Maybe finally about ultrasound, I would really want to recommend that you can do ultrasound whenever you feel necessary. I don't want to leave people who are suffering from issues like HIV, people who have diabetes, people who are on hypertensive drugs. A lot of people are there, and if you're having such chronic illnesses, you're taking in drugs that are being metabolized by your liver and your kidneys, you can really find time and ask your doctor to write for you, and you really go and check up on your organs, because it really, you want to check up and see, okay, I've been on RVs for the past 15 or 20 years, but how about my liver that is secreting those tablets day in, day out? So it will help you in early detection in case of anything.
Thank you so much, Bruce, and thank you so much to you, viewer. It's been a pleasure, especially knowing that you have been following from where we started from up to now. Edrine Mukalazi is my name. I've worked with Jonan and Patience. From the entire team, we wish you a blessed night.